Hi, my name is Alyssa Russ and I am a nursing student at Heartland Rehabilitation Center. Today I will be presenting a patient to you. The patient is a 74-year-old Caucasian male. He is a widower and lost his wife 24 years ago. He now lives with his sister in a mobile home. He originally worked at an assembly line making furniture and is currently retired. His source of medical care is Blue Cross Blue Shield. His heart rate is 52 beats per minute, his respiration rate is 14 beats per minute, and his blood pressure is 160 over 100. The patient's chief complaint is being unable to monitor his type 2 sugar diabetes correctly. The patient was diagnosed with type 2 sugar diabetes when he was 60 years old. He says he goes to the doctors once or twice a month to check his sugar levels. Recently, his sugar levels have been abnormally high, and he has had a hard time finding ways to lower it. For this reason, his doctor suggested that he check himself into Heartland in order to have his sugar monitored daily. When his blood sugar levels are high, the patient experiences constant thirst, frequent urination, fatigue, and loss of weight. The patient says he feels no pain while experiencing these symptoms, he just finds them annoying. He gets these symptoms 4 or 5 times a month. His symptoms get worse when he doesn't move around a lot and when he eats a lot of carbohydrates and meats. His symptoms improve when he eats healthier foods. The patient has not shown any efforts to treat his high sugar levels. He says he takes all of his medications, but the only effort he has shown so far was checking himself into Heartland. The patient says the diabetes affects his daily activities because when he's experiencing the symptoms, he finds it difficult to move around and he is too fatigued to do anything. The patient views this problem as not a huge issue and he is not very concerned with his health. In addition to diabetes, the patient has a history of hypertension. He is currently taking 8 medications for his hypertension. He has also had a bypass surgery on his heart several years ago and has gotten a pacemaker installed. Also, there is a history of myocardial infarctions in the patient's family. Both his parents and his 2 brothers died of myocardial infarction. I believe the abdominal system is the highest priority system that needs to be assessed. I chose the abdominal system because of the patient's type 2 diabetes and the history of being unable to monitor his sugar and nutrition. First, I will conduct a review of the gastrointestinal nutrition system. The patient experiences no nausea, vomiting, indigestion, or heartburn. He has no recent changes in bowel habits and does not have any diarrhea or constipation. He has a normal bowel pattern and has a painless bowel movement twice a day. He does report having constant phlegm and having a hard time swallowing. He does not find the food at Heartland appetizing and therefore has been eating less during his stay here. He says his favorite foods here are soup and mashed potatoes. The doctors at Heartland have put the patient on a low sodium and low sugar diet. He can only eat a certain amount of sodium a day and uses sodium-free salt. The patient says he tries to control his sugar intake by using sweet and low sugar instead of the actual sugar. The patient does not appear jaundiced and has no history of colon polyps. Now I will continue on to the abdominal assessment. Upon inspection, the patient's stomach appears round. The patient also appears overweight, which could cause the rounded stomach. The stomach is symmetrical. There appears to be a normal surface motion, color, and hair distribution. Also, there are no scars or lesions on the stomach. Upon auscultation, I heard a bowel sound every 2 to 12 seconds in each of the 4 quadrants. I also heard no bruise in any of the abdominal arteries. Upon palpation, the patient expresses no pain or sensitivity during the light and deep palpation of all 4 quadrants. The organs are all of normal size and I feel no abnormalities. There were also no abnormalities in the femoral arteries. The patient shows a negative cutaneous hypersensitivity, rebound tenderness, obturator test, and Iliopsoas test. Therefore, the patient has no peritoneal irritation. The second highest priority system that needs to be assessed is the cardiovascular system. I chose the cardiovascular system because of the patient's hypertension, bypass surgery, and pacemaker. It is also a high priority because of the patient's family history of myocardial infarctions. First, I will conduct a review of the cardiovascular system. The patient experiences no chest pain, arm numbness, jaw numbness, or heart palpitations. He does, however, express dyspnea upon walking short distances, which has increased over the past couple of years. He also experiences fatigue constantly. He has a family history of myocardial infarction and high blood pressure. The patient also says he cannot lie flat and needs 4 pillows to sleep. Now I will continue on to the cardiovascular assessment. All 5 key areas of the patient's chest appear normal. I see no heaves or lifts. The patient has a normal contour of the chest. Upon palpation, I feel no thrills or lifts on the 5 key areas of the heart, including the point of maximal impulse. Upon auscultation, I heard normal heart sounds in the aortic, pulmonic, Erb's point, tricuspid, and mitral area. There were normal sounds in the diaphragm. The patient had normal S1 and S2 sounds, and there were no murmurs, S3 and S4 sounds heard when the patient was on his side. An assessment I could have performed on the patient is the musculoskeletal assessment. This assessment pertains to the patient because of his recent lack of mobility. The sugar diabetes and hypertension make it difficult for the patient to move around. The patient even says that he loses balance frequently while walking and that it is often painful to walk. He reports that he sits for most of the day. This means that the muscles could be weaker than normal. A musculoskeletal assessment should be performed to check the strength of the patient's muscles and see if there are any changes due to his old age and lack of recent mobility. Also, weak muscles could make it harder for the patient to move. This would decrease the patient's exercise and therefore increase his blood sugar and blood pressure. According to the journal Exercise and Type 2 Diabetes, many types of physical movement may have a positive effect on physical fitness, morbidity, and morality in individuals with type 2 diabetes. Therefore, it is important to perform a musculoskeletal assessment in order to see how strong a patient's muscles are and how capable they are of movement and exercise. Another assessment I could have performed on the patient is the peripheral vascular assessment. This assessment pertains to the patient's current hypertension. The peripheral vascular assessment will check the pulses of the patient's lower and upper extremities. This will test if the patient's hypertension and pacemaker is affecting the pulses throughout the body. Also, sugar diabetes can affect heart rate and therefore can have an influence on the peripheral vascular pulses. According to a journal titled Assessment of Endothelial Function by Non-Invasive Peripheral Vascular Assessment Predicts Late Cardiovascular Adverse Events, it is important to assess peripheral vascular function in order to predict harmful cardiovascular events. This means that finding pulses in the extremities can predict if the patient has low blood pressure, clots, problems with blood flow, and drastic cardiac problems such as congestive heart failure. Here are my references, and thank you for watching.